Hi, we're going to talk today about sacroiliac joints. Sacroiliac joints, lots of people have got an opinion on sacroiliac joints. Today what I'm going to do is explain to you a little bit about sacroiliac joints and about my expertise in this particular area of work. Classic symptoms that you would probably recognise would be one-sided low back pain. Getting up from sitting is another thing that would normally give you problems. Turning in bed. So sometimes if you turn over in bed, you can wake up from sleep because of the pain that's generated when you turn over in bed. Trying to get your shoes and socks on or wash your feet in the shower is another difficulty in a lot of cases with people with sacroiliac joint problems. Radiating pain around the low back, one-sided generally. It can radiate into the buttocks, and it can also pass down the front of your thigh onto the inside of your knee, and it can also radiate pain into the groin in many people, and in gentlemen it can actually give you testicular pain as though you've been kneed in the groin. These are common, and they can range from between severe, which is a stabbing type of pain when you try to move, and also you can get a dull ache from that particular area, so it ranges from those different ones. Okay, so why do people travel a long way to come and see us for treatment of the sacroiliac joint? In many cases, people come from all over the UK to Atlas Pain Relief Centre in the Midlands for our expertise in this particular area of work. They travel sometimes from Europe, from Finland, from Ireland, Germany, all over Europe. They actually come and visit us, and we get many people asking us via email from America and Australia and all the way through the world really about our expertise and if we can help them. It's a very difficult subject to be able to help people over the telephone or help them without actually having an examination. So what I'm going to try and do today is to try and enlighten you a little bit about some of the things you should be doing if you suspect you have sacroiliac joint, or if you've been told you have a sacroiliac joint problem. Right, firstly, what makes us different? What makes us different, I guess, is our ability to diagnose sacroiliac joint problems or sacroiliitis. Many people will say you have these particular conditions, and when people travel a long way to come and see us, often we find that they have not indeed got sacroiliac joint problems, and there's nothing wrong with the SI joints. So we have to actually diagnose what their problem is and hopefully send them away with a diagnosis that they can go and get addressed more locally. Probably that would be a good idea. So some of the simple things that they need to do before thinking about travelling a long way to come and see us. We would probably be looking at saying you need to rule out the low back as a cause of the pain, because there are three distinct areas that can be very similar in presentation. One would be the low back. Two would be a hip problem, especially something like a labral tear. And three, the sacroiliac joint. So all these three things can be muddled up, and if you don't rule out the other two, which would be the hip and the low back, then it's very difficult to be able to say, well, okay, it is a sacroiliac joint without ruling the others out first. A sacroiliac joint particular inflammation type problem will not show on any scan. So there's no point in having any scans of the sacroiliac joint. Invariably, unless you have some sort of systemic disease, will you see a problem with the sacroiliac joint. So it's a hidden pain generator really. So what you need to do is probably get yourself an MRI scan done of the low back to rule out low back as a cause. That's the first thing you should do. Secondly, if it's possible to have the hip done as well, if you suspect it might be a hip, rule out the hip. If you've ruled out the two things, then there's a good chance it could be a sacroiliac joint if you have these type of symptoms that I described earlier. The next thing we're looking at is you need to be able to get some treatment. The treatment that we offer is unique because I designed this particular treatment. My name is John Williams. I designed this particular treatment, which is a range of things that we do. But unfortunately, the problem is lots of people come in with a causative factor of why they have sacroiliac joint problems, and those things need to be individually addressed as well. The reason why people say I'm reluctant to share my ideas about why our treatment is successful and what it is the fact that if I actually volunteered a treatment protocol for sacroiliac joint problems, and people adopted that, and it didn't work, they would say that the treatment protocol doesn't work for sacroiliac joints. And in probably most cases, what you would find is they didn't have sacroiliac joints in the first place, and therefore it's going to be a useless treatment for that particular problem that they might have. So it's important, if it is a sacroiliac joint, this particularly works really, really well, what we do. And it's a combination of things that we do. So as far as treatment's concerned, what I would suggest is one of the things that you can do to help with discomfort is an icing regime. So if you use an icing regime, using ice packs, now you need to wrap the ice pack in a damp tea towel, right? A damp tea towel. Now that's going to make the ice pack very, very cold. So therefore you have to be very careful when you apply it, that you shouldn't leave it on longer than 10 minutes. 10 minutes is the maximum, because it might trigger a thing called Lewis's hunting reaction. Lewis's hunting reaction is where the body gets so cold that it actually reverses the physiology and starts to open up blood vessels in the area and pour warm blood into the area to warm the area up, which has a heating effect. Now what you don't want to do is have a heating effect, you know, when you're trying to cool something down. So the idea is that you place this damp tea towel on with the ice pack wrapped in a damp tea towel, and you apply it for 10 minutes, remove it for 20 minutes and put it back in the freezer, right? That gives the body a chance to recover from the 10 minutes of treatment, and then you can reapply it again for another 10. So in effect, you have 10 minutes on, 20 minutes off, and 10 minutes back on again, okay? If you do that 3 times a day, 1, ice is cheap and free and readily available, and 2, it's an anti-inflammatory treatment, much better than trying to take medication and drugs, which will do you some harm with the side effects. And also, it's a painkiller, right? It helps reduce pain. So you have a free, readily available product that you can actually use to take away the pain and also reduce the inflammation on an area. If you do this, that will help you. That's part of a treatment that we would do alongside treatment that obviously in clinic. But it's a very useful tip that if you do have a problem in that area, give that a try. Okay, I will cut off here because there's other things I want to do on further videos. So thank you very much for your time. Bye.